With fall approaching, cold and flu season isn't too far behind, and this time of year there might be a little bit of confusion between COVID symptoms and cold and flu symptoms. And there are also concerns about the spread of monkeypox and the reemergence of polio. So let's turn now to an expert who can help us with all the important information on all of these concerns. Joining us is the president of the College of American Pathologists, Dr. Emily Volk. Dr. Volk, what do we need to know when it comes to the changing FDA guidelines around COVID testing?
Well, what the FDA is telling us now is for home testing, you need to test, and test again. So what does that mean? That means if you've been exposed to COVID-19, but you don't have symptoms, and you test yourself at home and you get a negative test, you should test again in 48 hours. If that's negative, you should test one more time 48 hours later. And if that's negative, you can rest assured you probably don't have COVID-19. Now, if you're symptomatic, it's a little different. You can test at home. If that's negative, and then 48 hours later, you test again, and that's negative, you probably have not got COVID-19. But that being said, if any of those tests are positive, you're going to want to assume you have COVID-19 and take appropriate precautions.
And what is the best way now to navigate between flu shots and COVID boosters?
Well, the good news is you can get the COVID booster and the flu shot on the same day, as long as you haven't just been vaccinated within the last 2 months or had COVID-19 within the last couple of months. So most people can get boosted and the flu shot at the same time, so it's super convenient.
It is definitely convenient. And what are some quick tips to know the difference between those flu and COVID symptoms?
Well, as you know, sometimes with COVID-19, you will get a loss of taste and smell, but we know that's not true always. And so flu and COVID have a lot of overlapping symptoms. The fever, the body aches, headaches, cough, those can occur in both flu and COVID-19. So we know that getting tested is the best way to tell the difference.
And what is the very latest now on monkeypox and the possible reemergence of polio?
Well, let's start with monkeypox. The good news there is cases do seem to be on the decline, which is fabulous. Folks who are at risk for monkeypox are getting access to the vaccine, and that is helping. With monkeypox, most people will not have a fatal case. It's uncomfortable, and unless you're immunocompromised, it won't be too severe, and it won't be deadly. Now, with polio, it's a little bit different story. At one point, we had wiped out polio in the United States, and that was because everybody got vaccinated. What we've seen in the last few years is a decline in the number of people who are vaccinated for polio, and that is why we've now seen a case in the United States. This is very scary to me as a medical professional, and I know to the rest of the medical community. What can I tell you is that everyone who isn't yet vaccinated for polio needs to get vaccinated for polio. This is an illness that can cause flu-like symptoms, but in some cases lead to life-changing permanent paralysis, an inability to breathe on your own, and in some cases, death. This is totally preventable with a vaccine. So any children, any adults who haven't yet been vaccinated, I urge you all to get that vaccine completed, to keep yourselves safe.
And finally, Dr. Volk, where can we go to get more information?
fda.gov and cdc.gov are two great websites where you can get reliable medical information.
All right. Thank you so much.
Thank you.